It's a graphic sight. Coffin after coffin placed near newly dug graves in Brazil for the victims of COVID-19. A staggering 1 million people have lost their lives, a figure many of us never would have expected when news of the virus first broke in January. But the number's not surprising to scientists.
In countries like China, India, the United States, Brazil, all of which have very large populations, go down with the virus, then you're going to reach large numbers, the million mark, which is quite psychological, I think, quite quickly. It's probably come about a bit quicker than I'd anticipated. If you'd asked me back in the spring, I would have thought later this year, perhaps a bit closer to Christmas.
Although the numbers of people dying seem to be much lower than earlier in the year in Europe, the virus is as virulent as ever. But limiting social contact has reduced infections and also deaths. And scientists understand COVID-19 a little more, especially the risk factors for severe disease, such as age, ethnicity and obesity. So doctors now have a better idea of who's likely to get it, to suffer more and need intensive care.
Trials of suggested therapies have been vital in working out what to give to patients. So that's meant no to hydroxychloroquine and yes to dexamethasone, as long as it's given to people at the right time when they come to hospital.
If I gave dexamethasone to somebody when they're not necessarily that ill, actually that might increase the risk of dying. But if we reserve the dexamethasone for people who are really very ill and therefore have quite a high probability of dying, then the dexamethasone can reduce the risk of death by about a quarter.
Does that feel okay?
Even if the virus doesn't kill, scans of infected people have shown it can cause long-term damage to major organs in the body. And younger people, initially thought to be practically immune to COVID-19, are among the hundreds of thousands suffering from long COVID, where symptoms last for months. So how many more will die? Scientists say that depends on how long it takes to get a vaccine, how effective it is, and how quickly it can be manufactured and distributed worldwide. Nicola Hill, TRT World, London.